that has my name on it now.
Not yet. It's just, we've been waiting. It's a special test that has to go to a different facility, but the doctor wants the results before your procedure. And we had somebody come, we had them be here by 6:30, so they've been waiting, cause we don't wanna let them leave and then you show up and then we gotta wait for them to come back and.
Oh my God, so the guy's going crazy?
Yeah, so they've been calling me, is she here, is she here? And I've been keeping them updated. Well, it look like she in the building, but she ain't made it upstairs.
Oh, okay.
All right, she just walked in, y'all.
Right.
Good. So we are very hopeful now.
Yeah.
That's all right. And then they take it, I have to put my name on it. You want me to help you? With Ava Davis on each of those.
No. Remember when I scanned your armband, right?
Have you been hospitalized every night in the last year?
Yes.
Not last year.
2 weeks ago.
Oh, yeah, yeah.
And where were you?
Right there.
Okay, excellent. You don't need this one. That doesn't apply. No, that doesn't apply.
Okay.
Yeah, let's go ahead and do this because it's the stenting. If you need to put whatever, the coil, or whatever it is, so I put it in there. This applies to that.
Okay, in case anything happens, they have to do that real quick, yeah.
Right. Okay, last one is for your IV sedation. This should pretty much be the same as the rest of those. That's what I'm saying. They're all, it looks crazy, but,
Well, that's okay, I'll do it real quick.
okay, this one is for your sedation. If you'll
And
initial
who
down
is my
here.
initial, who is my doctor?
Who's
Doctor-
your doctor?
Dr. Wise.
Yeah, so the nurse will administer the IV medication
Oh,
under the
okay,
direction of
okay,
the
yeah.
physician.
That'll
He'll be
be
right
perfect.
there with you doing procedures, so he directs the nurses what to get
Okay, perfect.
while he's doing his work. And then after you look over that, the last page is a signature for saying yes, those are your initials, and yes, you want your IV sedation. Okay, that's here.
No,
So you
no.
have had your blood drawn already?
Yes.
Okay,
At 7:25, 7:30.
okay. I'm gonna say peripheral. Angiogram is what I'm gonna say, and then whatever else he's planning on doing. The procedure is at 9 o'clock. We're good.
So which one are they going to use?
You're gonna use the monitored sedation. You're not gonna be completely asleep. You're gonna be very relaxed, sleepy, drowsy. You may not
There he
remember what's
is.
going on.
Look who's here.
Oh, yeah.
Mom.
He'll talk to you. How's that?
Hello, good morning.
Nice to see you. You're completely
And who
asleep.
is he?
I'm not sure.
Very trained.
Okay, I'll be back.
And then we put a drape over you from your chin down over your feet, and there's a hole inside the drape over your hip. And we're gonna feel your pulse there in that artery called the femoral artery, and that tube holds the blood vessel open while we do the procedure.
Okay.
And then we advance very small pieces of tubing up into the aneurysm in the brain. And then through that tubing, we put coil inside the aneurysm, and it clots it off from the inside.
Right, yeah, you explained that, but how are you gonna get from there?
It's all connected by
These
blood
different
vessels.
veins, and you know where they are.
That's right, and we take pictures to guide us. while
Did you
we
ever
work.
see a person with a vein like this one? In the hand, laying?
Yeah, there's a lot of variability in the hand.
Okay.
But we're not gonna be in the veins, we're gonna be in the arteries, which you
Right,
can't really see.
yeah, you can't see it now.
We're gonna give you heparin during the procedure, which is a blood thinner, so that we don't form any clots. And
Yeah,
we're-
I took my aspirin this morning and that other thing.
And your Plavix.
Yeah, they told me to, so I don't know.
Okay, that's what I want you to do.
Okay, and then now you
Because
don't
one of the
need something
complications
else.
of the procedure is clot formation, which can block blood vessels and cause stroke. So we're very conscientious about the aspirin Plavix, and then we also give you heparin during the procedure. Heparin is a blood
Heparin's a
thinner.
great blood thinner.
It's a powerful one.
It's the standard one. It is a powerful medicine. It makes it, and it's, what's good about it is it's reversible, right? So I can have it on during the procedure, and then I can turn it off whenever I want.
Excellent, oh, that's nice.
Then the risks of the procedure: pain, bleeding, infection at the puncture site, complication related to anesthesia, which might be something like nausea, vomiting afterwards, difficulty with the intubation, can give you a sore throat. You could have an adverse reaction to the contrast, but we've given you contrast in the past and you haven't had a problem in the past, so I don't think that's going to be a problem here. And then complications related to the wires and catheters and devices in the brain would be stroke or bleeding inside the brain.
And is that, but that's 99% safe, right?
There's more than a 1% chance. There's a couple of percent chance of having a complication, 2 or maybe even 3%.
And then what, like I lose my memory or something?
Some people have stroke. It's very rare.
But
I
it
do everything I
happens,
can
right?
to avoid it, but it's a possibility.
Yeah.
But the flip side of that is doing nothing
It's worse.
and observing the aneurysm puts you at risk for the aneurysm to rupture without treatment.
Yeah, I think that's it, yeah, that's.
And
awful,
that,
right?
and an aneurysm rupture is fatal, greater than 50%
paralyzing.
of the time.
Yeah.
Greater than 50% of the time, if it ruptures, it's fatal.
Well, that's good, I would like
You
that.
don't
but
want that.
Yeah, if you say 100% fatal, I wouldn't even be here, but if it is 50, because if the other 50 is you get paralyzed, right? And
There's
you're like a vegetable or something?
of the 50% that survive, another 10 or 15% have long-term disability.
See, only 15%?
Right.
Oh, yeah, that's not too bad. Okay.
But it's not a good thing.
No,
It's a really bad thing. We don't want to let that happen.
no, that's right,
No, it won't happen.
right.
Okay. So I want you to do a couple things for me, all right?
Okay.
I want you to watch my thumb with your eyes. Okay, close your eyes. Don't let me open them. Okay, open your eyes and raise up your eyebrows for me. Okay, smile real big. Stick out your tongue. Move it from side to side. Okay. Now when I touch you on both sides, does it feel the same on both sides? Is it the same on both sides when I touch you up here?
Yeah,
Is it the same on both sides when I touch you
Yeah.
down here? And how about here?
it's a little numbness, but that could have been from a facelift. I had some time ago.
Okay.
That's always been like that.
It's a little numb on the left.
Yeah, a little slight, yeah, nothing to worry about.
Shrug your shoulders for me.
Perfect. Or shrugging?
Uh-huh. And then push against my hand. And push this way. Okay. And then put your arms out like you're holding up a pizza box. Okay, and I want you to close your eyes. Don't let your hands move. Okay, you can open your eyes. I want you to grab me and pull me toward you. Now push me away. Great. Very strong.
Very strong.
You are really strong.
Yeah.
I'm glad to see that. Okay, now I want you to touch my finger and touch your nose and go back and forth as quickly as you can. That's good. Now, that's good. That's how I want you to do it. Now do it with the left hand.
Oh, because, I'm a left-handy.
She's
I was born a lefty.
Uh-huh.
I think
Okay,
my
that's
right
good.
hand,
That's
not my
excellent.
left hand, so I wouldn't.
Really?
Yeah,
That
that
is
was the
amazing.
primitive, the old days, that's how
You
it
know,
was.
my dad, I was born
Yeah.
right-handed, and my dad wanted me to be a left-handed baseball pitcher, so he always put the ball in my left hand so that I would pitch baseball lefty.
I eat with my left hand.
Isn't
I'm
that
right-handed, but I
awful?
eat with my left hand.
Yeah.
Aren't you glad you became a doctor instead?
Yes.
Oh, God.
Although I wouldn't mind being a professional
No,
baseball
that would be
player.
fun too.
Okay, let me have you lift this up. Okay, and then pull it down. Pull it down. Okay, good. And the same thing with this. Lift it up. And then pull it down. Okay.
Yeah, it's
Now,
interesting. It's
when
a
I
little
touch
hard,
you, when I touch you on both sides, does it feel the same on both sides on your legs?
Yes, perfect.
Okay.
God, did you see that stuff? Because of the blood thinner, that's
That's
okay.
probably from the
Yeah,
plaque.
that's okay. Yeah.
I want you to take your right heel, put it on your left knee, and slide it down and back up.
Oh, yeah, that's
good.
what that
Okay,
Indian
and then
doctor
the
did,
same thing
yeah.
on this other side. Okay, good. Now one last thing, I want you to go, put your right hand out, and then I want you to go back and forth like this, as fast as you can. Okay, and do it the other way with the other hand. Okay, you're doing great.
God, that's better than this one.
So,
Faster, yeah.
so you haven't had any symptoms since we discharged you from the hospital on the medicines? Have you had any of that recurrent
reaction
stuff
to the
that brought you
medicine,
here
no.
before?
No, she's actually improved.
Only
Yeah.
that
Slowly.
Bummed out feeling, like, little like, not a headache, but in the middle there, which I never had headaches in my life, ever.
questions about it before we start?
No, I think everything is wonderful. You seem to be in great form. You have good memory. You know it's on this side, right?
Well, you told me before I even had to remember it, so. That's a test. The other thing I'm going to do
So
today
nice.
is, in addition to treating the aneurysm, I want to inject the blood vessels that go up to the basilar artery where you have the stenosis on the CT angiogram.
Uh-huh.
This test is a little bit more high resolution than the CTA, and it also gives some additional information that can just help
Important
if
later on.
at some time in the future, if you were to have an additional
Stroke.
strokes, then I could give you better advice on how risky the treatment would be if we try to do a procedure to correct it.
Okay.
That's just one extra step of the procedure that only takes a little bit
And
longer.
it's
and
for
gives
my
us-
benefit.
It's for you.
And you know, I signed that I don't want any students. Or
There are any
every- because I had a terrible experience once in a hospital with the student business, and I said, never again. So,
It's just me.
yeah, that's
Me and
fine.
the other,
Yeah, right.
me and the other ICU
your
doctors
assistants, yeah.
and the nurses and
That's good,
technologists.
that's good. Okay, then I'm
Okay.
perfectly happy.
Any
You're
questions?
ready to
No, so
go.
no questions? Any questions from you?
Actually, it's somewhat related and not related. Just a quick question. My sister, we think she's expressed that she had a concussion. And I was just curious, can we see that in a CT scan versus an MRI?
Well, one of the definitions of concussion is that it's a clinical neurological injury without an imaging.
Oh, so it's clinically diagnosed. It's not something you can see.
Diagnosed based on like neurologic symptoms after trauma or loss of consciousness, and then we do a CAT scan or we do an MRI scan, and those are normal. If there's an injury on a CAT scan, then the diagnosis becomes whatever that injury is, like contusion. Some people get a contusion of the brain, or which is a bruise essentially of the brain. Then it's no longer a concussion; it's a contusion. So a concussion is more mild.
So you can see a contusion, but you couldn't really technically see a concussion. You're just making that diagnosis based on symptoms that you
right.
are seeing.
So,
Okay.
what is the deal when somebody tells you, Mom, I can't stop talking, I talk all the time and I can't stop myself, and I have this conclusion, you know, she hit her head real hard twice, and then she had 106 fever and went to the hospital with it,
Wow.
and then now, everybody thinks she's on drugs, including me.
Mm.
And she has a history of that, and her boyfriend does too. But I know she's not on cocaine because I ruined her nose, and she's really pretty and very, self-absorbed. So she doesn't do that anymore, but she might be doing something else. And then she has this crazy psychiatrist that ordered like 90 milligrams of
Adderall, which was
Adderall.
crazy.
To take 3 times a day.
Okay.
It's like she's jumping out of her skin.
I
And
would
if
bet
you
that the
talk,
That much-
Adderall's a stimulant, so
I
That
know.
much Adderall's a lot.
But I mean, I'm just worried, and then she said, I don't take that. And I said, okay, but then, and then, she talks and talks and talks. Even when you go to a movie with her, she wants to talk. And then finally, I said, well, okay, I think you have a problem. And I didn't bring up drugs or anything. And then she was like, I saw her real, like a little human, like she used to be, because she's not my daughter anymore. I don't know who this person is. So I said, maybe you have a brain injury or something, and maybe you should have to I'll ask my neurologist, I say, because we'll be cash patients, because she doesn't have insurance. But maybe now she's forced to have it, right, with that Obamacare.
Well,
insurance.
that's too late
But
now.
anyway, I said, I'll pay for it if you go to my neurologist, if I survive all this operation and stuff, and which all will be fine and everything, and then you can
Tell us.
prove that you are not on drugs and that you have something wrong with. She says, twice, Mom, I have a huge brain swelling and everything. And so I thought I asked you about it because
Yeah.
I don't know anybody that she can do this favor. Maybe you can tell by just talking to her or doing a